Hi, I'm Deb Miller. I'm the director of the Public Management Center at the University of Kansas. I'm pleased to introduce this webinar series. We've missed engaging with you live and in person. Who knew something so common could now feel so precious and valued? Though not live and in person, we hope these webinars will provide you with a convenient outlet to continue learning, and in this now daily virtual way, connecting with other public sector professionals. Because they are pre-recorded, you can view the webinars as your schedule allows, share them with others if you choose, and listen to key points more than once. Each of our speakers has offered to make themselves available to answer your questions. If you have questions, please leave them in the chat or in the comments below. We will either connect you with the presenter or respond to you with an answer. Here at the PMC, we believe that public service lies at the heart of democracy. During these strange, uncertain times, you are doing democracy in ways you never imagined and finding workarounds you never expected to need. We salute you and hope that in some small way, we can support and assist you in your work.
Heather Getha-Taylor is an associate professor in the KU School of Public Affairs and Administration. She is the author or co-author of over 60 articles, book chapters, and other scholarly reports on public and nonprofit management topics, including her article, Identifying Collaborative Competencies, which received the Best Article Award from Review of Public Personnel Administration. Her collaborative Engaged Scholarship project on leadership training evaluation was recognized by the Kansas City chapter of the American Society for Training and Development, and also the KU Steeples Service to Kansans Award. She teaches undergraduate and graduate courses and is the recipient of several teaching awards, including the 2018 Honorable Mention Award from Syracuse University's Program for the Advancement of Research on Conflict and Collaboration for her report titled Epidemic, a Community Health Collaborative Simulation. In 2017, she was selected as a Hubert Project Fellow by the University of Minnesota's Humphrey School of Public Affairs and created the online case study teaching resource titled Right for Change, Just Food's Recovery from Executive Misconduct. Heather has served the University of Kansas and external groups in leadership roles, including as faculty fellow for the KU Center for Civic and Social Responsibility and book review editor for Public Integrity. She also serves on the editorial boards of Public Integrity and the Review of Public Personnel Administration. She currently serves as editor-in-chief for Public Personnel Management. She is a regular presenter at academic conferences and professional meetings and also serves those associations in various roles. In 2017, she was elected to the board of the American Society for Public Administration's section on Personnel Administration and Labor Relations. Heather was also appointed to the Government Finance Officers Association's Research Advisory Council for Human Capital Research.
I really appreciate the invitation to offer this webinar today, and I hope that it offers all of you who are joining us some context on employee health and some practical suggestions for moving forward with resilience in the era of COVID-19. I think it's an understatement to say that this pandemic has introduced challenges the likes of which many of us have never experienced before. And the term that keeps running through my mind is the idea of precariousness. That is the feeling that we're not secure and our future is uncertain. And this term I've borrowed from Professor Arnie Kalleberg, who talks about precarious times. And I think we're all dealing with precariousness in many ways. The precariousness of jobs, of health. And there have been some images that have been shared on the internet that I think help lighten the mood a little bit as much as is possible in this pandemic. I think when we think about, for instance, our essential workers who are on the front lines of the pandemic, and also the people who are trying to navigate these spaces in new ways that we've never done before, I think we have to exercise some compassion and understanding towards one another. We're also dealing with isolation and the blurring of our work and personal spaces and really engaging in our activities in ways that we've never done before. And then, of course, we now have very needy coworkers like newscaster Jeff Lyons. His cat Betty made headlines for being a collaborator on delivering the news. But again, these are rather lighthearted ways to look at the pandemic. But it's really important to remember that in addition to the strain that is produced by this pandemic, we are now also experiencing the shared pain and tragic and continuing examples of racial violence and entrenched structural discrimination. And these images show you what's happening where we are here in Kansas City. And together, these forces could inflict long-lasting trauma on an unprecedented scale. So the overall question for this webinar today is, how can public service managers help ensure the health and well-being of their employees and themselves in these very challenging times? Given the fact that we are trying to make this an efficient webinar experience, I'm going to focus my remarks today on the pandemic, noting that this is just one source of stress that we're dealing with right now. And before I move into the content for today, I first want to recognize two doctoral students who I work with and who've helped me to think about these issues. So I want to give a special shout out and thanks to Morgan Farnworth and Justin Moen. As we move forward through this webinar today, I'm going to offer you some concepts, some examples, and also some opportunities for reflection. And when I offer you those prompts today, you might want to write those down and revisit them after the webinar. Again, we're trying to make this an efficient webinar experience for you. We know your time is very valuable, and I just want to say thanks again for joining us. So let's get started by setting some context and understanding how the COVID-19 pandemic has impacted the workplace. According to an April 2020 survey by the Society for Human Resource Management, 35% of employers across sectors say that they're grappling with changes in employee productivity. Further, 2 out of 3 employers have said that maintaining employee morale has been a challenge in the COVID-19 era. Now, perhaps this is unsurprising to you, but one thing that I want to note is that across sectors, employees are dealing with the very precarious situation of potential cuts in pay and workforce reductions. And employers are seeing increased requests for information on employee assistance programs. This tells us that employees are looking for help in terms of health and well-being in this era. So my first prompt for you today is, how do these results resonate with your own experience? What have been the most substantial impacts of the COVID-19 pandemic in your workplace, either at the individual or the organizational level? When we think about employee health and well-being, we have to consider that those outcomes are the result of many elements. And I wanted to share this figure with you from the Substance Abuse and Mental Health Services Administration. As you can see here, well-being is a product of many dimensions. Sometimes we tend to make it too simplistic and expect that employee health and well-being is really just a matter of personal decisions and behaviors. But as you can see here, a variety of things that we do in our workplaces stand to impact employee wellness significantly. So for instance, you might turn the mirror on your organization and ask, how sufficient are our benefits to provide well-being? Do we provide adequate and affordable health insurance? Do we provide time off? What type of work do our employees engage in? Are they exposed to physical dangers or occupational hazards that might impact their wellness? Another way to look at this is to think about your organizational culture and the degree to which it impacts employee health and well-being. Do employees feel that they are heard? Do they feel valued? Are they empowered? Now, this emphasis on employee wellness and employee well-being is really a contemporary one. Traditionally, we've thought about employee health in terms of compliance with legal frameworks. So things like compliance with the Americans with Disabilities Act, or the Family and Medical Leave Act, or OSHA regulations. But there's a lot of other reasons that we need to be concerned with employee health and well-being, not just legal compliance. It is perhaps very unsurprising to you that the costs of healthcare are increasing. They continue to increase. If we have healthy employees, we would expect we would see less utilization of healthcare. We would see use of fewer sick days. We would see fewer worker comp claims. Those are all things that are within our organization's best interests. We also would expect that if our employees are healthy, that they're going to be more productive. They're going to be more satisfied with their jobs. In fact, they're going to be happier. And the research points to this connection between individual employee health and organizational investment. And while we understand that there's a connection between those two things, employers have not paid attention to this as much as they could have. That in fact, many organizations adopt really narrow definitions of employee well-being, like reducing exposure to harmful chemicals. That doesn't illustrate an approach to embracing health and well-being. So I would ask you here, how does your workplace illustrate a concern for employee wellness? Where are some areas that you could improve that focus within your organization? As you think about this, I'd like to offer you another model to consider. This is from the CDC. I would ask you to take a look at this and assess the degree to which your organization is already thinking about workplace health. You could start with step 1 and try to issue yourself a progress report of sorts. To what extent are you assessing the need for health in your workplace at multiple levels? How is that connected to your plans, your management initiatives to improve health? Do you have evidence of the variety of programs and benefits and support that you're implementing? And then finally, are you investing in evaluation of those efforts? You can use this as an assessment tool. And I would encourage you to take a look at this slide and think about how you can use this model to improve the ways in which your organization is addressing employee health and well-being. When we think about assessing and promoting employee health, in some organizational settings, we've pushed this to the individual level and tried to explain that employee health and well-being is really a product of individual behavior and individual choices. But I'd like to show you a figure that I think really turns this on its head. When you take a look at this figure and focus specifically on the fact that health behaviors are really only attributable to 30% of your health outcomes. That is, the length of your life and the quality of your life depends on much more than just those specific individual health choices. Rather, your degree of clinical care, that is your access and quality of care, social and economic factors, as well as your physical environment together determine your length and quality of life. So much of our health is determined by structures and external conditions. And I'd like us together to consider an example from current events to illustrate this point. This comes from NPR, and this graphic is from Stephanie Edelin. And this is using CDC data to show us that there is significant disparities in COVID-19 cases by race. In our population in the United States, African Americans comprise 13% of the overall population. But as you can see at the top of this slide, they represent 33% of the hospitalization cases of COVID-19. By comparison, whites make up 76% of the US population, but only 45% of hospitalizations. We would ask the question, why is this the case? Well, Dr. Anthony Fauci of the National Institutes of Health says that it's not because African Americans are more likely to be infected by coronavirus. Rather, it is because of underlying health conditions such as diabetes, hypertension, obesity, and asthma, which might make it more likely that African Americans are admitted to the hospital or die from this disease. And this is illustrated to you quite clearly at the bottom of this slide. This slide is an example of how COVID-19 hospitalizations illustrate the health disparities that were featured in the previous slide. What this tells us from a management perspective is that some employees are going to need more help than others to get through this very difficult time. We simply cannot assume that all employees are dealing with the same set of circumstances. And this requires that managers embrace the value of equity. And what I mean by equity here is that some employees may need more or different forms of assistance than others to fully succeed. In order to embrace equity, that means that we have to prioritize a concern for people. I'd like to show you a figure that I think illustrates this. This is the Blake and Moulton managerial grid. And for those of you who have seen this before, this is really an opportunity to assess yourself on two dimensions of management philosophy. As you'll see here on the x-axis, we have the concern for task from low to high. The y-axis is concern for people from low to high. Now, you can see in this grid that it is ineffective to have too little of either of these. But in many organizations, we find ourselves too high on the concern for task and too low on the concern for people. This grid reminds us that the best form of management is when we are concerned with both task and people. So when you think about this, how would you assess yourself? Do you find that you effectively balance a concern with people with a concern for task accomplishment? If you have too little concern for people within your organization, how might you as a group change that orientation? One thing that you can do in your organization is to think about what it means to act with empathy and understanding. In this moment in particular, it is important to remember that your employees are experiencing significant losses. They may be experiencing health losses, the loss of financial security. They may have lost loved ones. They're also missing important life events like graduations and weddings. Professional conferences have been canceled. They're missing out on networking opportunities and training events. Your employees may be grieving these losses. Dr. Patricia Frazier from the University of Minnesota notes that many people will suffer trauma and losses in this situation, but most people are resilient. She adds that most people will not develop serious long-term psychological distress, but that requires adopting coping mechanisms in this pandemic. And one of the tools that she recommends as a coping mechanism is something referred to as downward social comparison. Downward social comparison helps us to see that others' suffering may be worse than our own, and it helps put our losses into context. So my prompt for you here is, first of all, do you think that most people are resilient? And second, have you ever used downward social comparison to help you move through trauma and loss? Well, Kansas City certainly provides an unfortunate example of this idea. As mentioned previously, life expectancy is a key health outcome. And life expectancy varies greatly in the Kansas City metropolitan area. This is a graph from the New York Times. And our metro area shows 23 years separating those with the highest and the lowest median income levels. Where I live in Johnson County, I have a significantly different life expectancy than my neighbors in Wyandotte County. Those living in Johnson County can expect a life expectancy of 81 versus 77 in Wyandotte County. What this means for managers is that coworkers within the same organization may be experiencing very different health realities. So my question for you here is, what explains this discrepancy? Is this just an illustration of individual health choices? Or is it something larger, like that figure we saw earlier in the webinar? Is this perhaps an issue of access to healthcare or affordability of healthcare? Or could this be an illustration of the impact of individual or community trauma? Now, I mentioned trauma previously, and I think it's worth our time to spend a couple of minutes thinking about what is trauma. And I've provided a definition for you here, that trauma is an event that threatens the life of an individual or a loved one. As you'll see, there's a list of traumatic experiences. And as mentioned at the start of this webinar today, racism, discrimination, and oppression is a traumatic experience. I would add to this list that the pandemic, the COVID-19 pandemic, is also a traumatic experience in that it threatens the life of individuals and their loved ones. What is very unfortunate about this slide is that it is estimated that 62% of all US adults have had at least one traumatic experience. 25% of US adults have had at least 3 traumatic experiences. As I said, I believe this pandemic represents a traumatic experience. It is also prompting other forms of trauma. According to a report in the Kansas City Star, our metro area's domestic violence calls went up 26% during the stay-at-home orders. For you as managers, it's very important to understand how the experience of trauma impacts people and their performance. Trauma has long-term significant implications. Some of those implications include implications for health. So for instance, those who've experienced trauma are more likely to be depressed or to have chronic disease. Trauma affects well-being. People who have experienced trauma are more susceptible to the effects of stress, and they're more likely to be injured. Trauma also impacts long-term opportunities, professional opportunities, financial and education opportunities. Now, while the language of trauma is familiar to the fields of health and education and psychology, I think it is often less familiar to public administration. So I think this is a moment for us to think about what it means to be trauma-informed professionals. Part of this means thinking about the idea of the wounded healer. And the wounded healer idea is all about this concept that some people may be drawn to public service because of their own adverse experiences, their own traumas. In this case, trauma-informed practice is even more important for you as a manager. Not just for the people that you serve, but for your employees as well. I'd like to share with you an image to help you think about some ways that you can engage in trauma-informed practice if this is something that's very new to you. This information comes from the Substance Abuse and Mental Health Services Administration, and it provides for us the guiding principles or core tenets of trauma-informed care. And I would prompt you here to think about the degree to which your organization embraces these practices. What are your strengths? What are you doing well? Where are there gaps? And what can you do to help improve the use of these practices in your workplace? In addition to thinking about workplace level changes, it's also very important to consider individual ones. For example, ICMA recommends creating a personal resilience plan during this crisis. So how are you taking care of yourself? Are you sleeping enough? Are you eating well? Are you getting the physical activity you need? Are you setting appropriate boundaries so that your personal and professional lives don't become blurred to the point that you don't recognize the differences there? Part of creating a personal resilience plan is practicing what I learned as a young child to be the serenity prayer, essentially. That is accepting the things that are within your control and letting go of the things you can't. Of course, I know it's very difficult every time I go to the store and they still don't have my things in stock. That's tough. It's also important to remember, as part of your personal resilience plan, that it is perfectly okay to allow yourself to grieve the losses that you are experiencing and to feel sad about them. While downward social comparison has been identified as a coping tool to put your losses in perspective, that doesn't mean that you can't recognize the loss. It's also important, as part of a personal resilience plan, to show compassion to yourself as well as others, and be aware of the impact that this moment in time is having on performance, your performance, the performance of others. Without self-care, one of the things that we would be concerned about is burnout. And I think burnout is an idea that is familiar to most of us. This concept comes from the work of Dr. Christina Maslach. And even though I think we have sort of a surface level understanding of burnout, I thought it would be helpful to spend a couple of minutes just talking about what are some of the indicators of burnout so that you can be on the watch for this. So first of all, you might be experiencing burnout if you are experiencing physical and emotional exhaustion that is not resolved through rest. Second, if you feel detached from your work or cynical about your work, that may be an indicator of burnout. And third, if you've seen a fall off in your performance, or if you feel ineffective in the work that you're doing, you might be burnt out. So the question is, if you fall into any of these categories, what can you do about it? Well, first of all, make adjustments. Try to find ways to take control of your time and redesign your work. Second, find support. Reach out to supportive peers, mentors, friends, family. I think all too often, leaders are expected to be totally self-reliant and to solve all the problems, including their own. And this is not the moment for that. And last, one of the ways to deal with burnout is to cultivate resilience. So what is resilience? Resilience is a positive way of coping with stress and adversity. And it is an element of psychological capital. Psychological capital is a construct which includes 4 core concepts. And this is based on the work of Dr. Fred Luthens and colleagues. And the reason that I think it's important that we spend a couple of minutes on psychological capital is that this can be a very powerful, practical tool to manage through this pandemic and counter burnout. The first element of psychological capital is hope. Hope has been defined as a positive motivational state, and you can actually cultivate hope. The way you can do this is through what's called hope mapping. Have some small milestones that you can look forward to. What are some things on the horizon in the weeks and months ahead, and maybe after we're on the other side of this pandemic, to give you a way to move through the difficulties that we find ourselves in right now? Secondly is the idea of efficacy or self-efficacy, and that is your confidence in your ability to achieve your goals. We have to keep in mind when it comes to efficacy that your thoughts are going to shape your reality here. And that when we're going through negative experiences, one of the ways that you can build efficacy is to reframe those negative experiences as learning opportunities. So you might want to ask yourself, what are you learning during this pandemic? And how can you apply those lessons to future adversity? The third element is resilience. As I mentioned previously, this is a positive way of coping with stress and adversity. When you think about how to do this, how to overcome negative events, resilience tells us that we have to learn to face our reality and to find purpose in even the negative aspects of that reality. I think it's important to keep in mind that while a number of our important life events and our plans were put on hold or canceled, that's not the end, and there is still an enduring purpose that extends beyond these temporary difficulties. Finally is optimism. And this is really how you think about your own success, whether or not you think about that as the product of your own internal forces and drives, or are there external forces that impact that? And we can only begin to accept the past and appreciate the moment and see the future as a source of opportunity when we can really focus on the fact that external events are going to influence us. And we have to recognize it's not just our failures, it's not just our faults, that there is optimism in realizing that things do happen and we can work through them. And that's really the takeaway of psychological capital. So as you will see, we've got H for hope, E for self-efficacy, R for resilience, and O for optimism. And this is the HERO model. HERO. We often tell children that they need to be the heroes of their own story. And what does it mean to be a hero? It means that things don't just happen to heroes, right? Heroes make things happen in spite of the things that happen to them. And that's what this is all about. This is a difficult moment for sure, but we have to think about how we can move forward productively. And these are 4 ways that we can do that. As we wrap up for today, I just want to share a few closing thoughts with you. I recently read a really insightful article in the Chronicle of Higher Education about adapting to this new reality. It was written by Professor Brandon Bain at UNC Chapel Hill, and he gave some advice for those who are tasked with managing in this situation. He said, first, remember that no one signed up for this. None of us expected or wanted illness and social distancing for months. Also, we need to remain flexible and adapt to this situation with understanding. And finally, the humane option is always the best option. We need to support one another. We need to share resources. We need to communicate effectively. I want to close by noting that it is so important that we remember this human element of management in these trying times. Please remember that your employees are experiencing this crisis and their own health realities very differently. It's important that you engage in self-care, that you show compassion to yourself and others. And remember that we're all doing the best that we can. I love this image from the leadership learning community. And they presented this and asked, who is it that you want to be during the COVID-19 epidemic? And I think we all want to be our best selves and move out of this fear zone, right? We want to move into the learning zone and the growth zone. But we're all navigating this just one day at a time. Some days are going to be better than others. And if you're like me, this might be your reality, where we're all over the place, but we're trying. As we move through this together, and as we try to move into learning and growth zones, let's also remember to put our values into action. Values such as equity. And think about how we can make our workplaces healthier and more supportive environments for all employees. Thank you so much for your time today.